what did you do to avoid burnout if you experienced it? I love it how she said, or he said, if you experienced it. Oh my goodness. Yes, I did experience burnout and high stress in my job. For those who don't know, I did my first 5 years in the ER. I was a brand new baby nurse, new grad. I went straight into the ER, and it was rough some days. And, burnout is real. And it's real in all the professions, not just nursing and healthcare. It's everywhere. And there are some days you just don't want to go into work. But what I do is I try to remind myself of the good times and remind myself the positive things. And even when I'm working, I really focus on that patient was really nice. I really do appreciate when patients are nice to me or appreciate me, or that cute little grandma who just keeps saying thank you for what you're doing, even though you're putting in an IV and that's not, doesn't feel good. I try to compact all those happy stories into my brain and think about, the positive aspects of the job, because there's some not so great parts of nursing, and that's where burnout comes from, right? You're just being overstressed. So I do try to focus on as many positive things as possible, and I'll even write them down after a really bad shift, because even bad shifts have really good things to think about. Another thing that I do that I did when I was working in the ER specifically, is I kept very organized. I would carry around a very small piece of pad that I could slip into my pocket and keep a track of things that I wanted to make sure that I did. It's on that list of things to do and prioritizing, and, when something's important, I make sure I write it down. Or, it could be as, patient in room 3, needs a glass of water. So 3, water. Because I know I'm going to forget about those little things. And those little things are so important to patients, especially when they're waiting in the ER for 6-10 hours or more. And I like being able to do those little things just as much as the bigger things, like trying to save someone's life. Because those little things are very important as well. So by keeping myself organized with that little piece of paper, and by keeping a reference guide on me, I created a nice little thick reference guide that I, wrote out, printed out, typed out, of things that I just didn't see every day. For example, pediatric vital signs. I don't know why they are so difficult to remember. I can recognize the true emergencies, the highs and the lows, but to know those specifics, for some reason, I just didn't run into enough pediatrics every day. I might have taken care of one a week, which is not really good at keeping up your skills. So the way I tried to decrease my stress level is I'd have this reference guide full of things that I could reference during the day, and it would make me feel more confident, and I could just, run through things a lot faster. I guess those are my 2 biggest strategies that I could think of for myself, but there are so many different strategies out there because we are all different. I wrote some of these down, so forgive me as I'm looking downward. What worked well for some other nurses and, generally considered a good technique include coping strategies like meditation and deep breathing, even journaling. I guess I did a little bit of that, and finding a hobby. If you can separate work and play, if you can have a good play day, that really decreases your stress. And I have to say, I really tried hard to learn how to meditate. I thought that would be so helpful for me, but no matter how hard I tried, that coping strategy just wasn't for me. So it's important to keep trying different things as well. Asking for support from coworkers and supervisors. I did this as well. I don't know why I didn't think of it before. I really did. I mean, I did ask for help from my coworkers and supervisors because they are there to help you. It is a team environment, or at least it's supposed to be a team environment in the nursing world. We're supposed to help each other because you will always, not always, you will sometimes find yourself drowning and you need that extra help. Same thing with other people. And you know, just really working as a team really can help decrease that burnout. Although if you're understaffed, that's a completely different issue and a different video. Taking care of your body. We all know this one. Eating regularly and healthy, sleeping enough, and exercise. I did try my best to follow these, but I do remember being very... I do remember liking Pop-Tarts. I would just munch down on Pop-Tarts, and that was so not good for me. And I never felt good after I ate those, but you do when you're eating. It's just a very bad coping strategy. So don't eat Pop-Tarts if you start getting stressed. And finally, seeking professional help. Talking to a therapist or a counselor can be immensely helpful. You know, if you have problems with your heart, you see a heart doctor. If you have problems with the way that you're thinking and becoming stressed or depressed, go see a head doctor or a therapist or a counselor. It doesn't have to be a doctor. Talk with someone. You could, I mean, heck, talk with a parent, talk with a friend. They don't necessarily have to be in healthcare. I mean, for how often that I talk to my husband about these things, you know, he is a key in my support system, and that's also very important. So I guess I use a little bit of that strategy as well. I try to keep all the gory stuff away from him and keep it pretty generalized knowledge, but he does, you know, help me think through things and think about the positives. So I do that to avoid burnout, or at least I try to.